Good evening, everybody. It's a great privilege and pleasure to present this presentation on problems, basics and problems of mental health on this library platform. And problems on mental health, we can title it otherwise like for a healthy mind. So problems of mental health are very much increasing, globally increasing, especially ever since after the COVID pandemic. We have the World Mental Health Day coming up on this October 10th every year. This year also, now we are in September, next month. October 10th would be the World Mental Health Day. And this coming one of these days, September 10th, would be the World Suicide Prevention Day. And all these days, why we are celebrating or observing, because there should be more and more awareness. Of course, compared to how the awareness of mental health has been in the past decades, especially over the COVID pandemic and after the COVID pandemic and all is over, because of rising number of suicides and stress-related many symptoms, even stress-related physical symptoms and psychological symptoms, and the rise in all those things, and the overlay between the physical and the psychological symptoms and all, the awareness of mental health has increased, of course, but still, it is not up to the mark, because still people are committing suicides. Even people with much awareness and even with some access to resources, we are not able to handle it very effectively. So sessions like these, where we deal with problems on mental health, is very important. And I have tried as much as possible to be in the more simplistic manner, so that even a lay person can understand, even a non-medical person can understand. Because of course, medical people, of course, they know a lot. So of course, the message has to reach the non-medical people also. Even in the non-psychiatric specialties also, there are people, I've come across even some of my colleagues having doubts about whether these psychiatric medicines will cause a lot of side effects, whether they are all addictive, whether they are very costly. And so even among non-psychiatric professionals also, there should be much awareness. And then among the non-medical people also, there should be much awareness. And so this is a small slide where we are asking, are you all right? All right is an acronym actually here. Approach, listen, reassure, immediate, guide, hope, together. So, of course, all are not mental health professionals, but we all come across a lot of individuals, many people that I do not ever come across in my life. Some of you might be coming across, some of you might be interacting with in your day-to-day life, as your family members, as your neighbors, as your friends, as your relatives, as your colleagues, even some contacts in the social media. So any person can be a potential help to a person with mental health problem, provided they approach the problem in a right way. So how we approach the loved one in opening up to us and sharing their thoughts with us when we find that something is wrong, and when we see that they are not doing that well as they used to do before, or we find that some odd behavior, some odd beliefs, some kind of probably some, even sometimes it might be the colleague that you are working with is feeling sleepy during the day. Then you can ask, oh, how was the sleep yesterday night? Then he might be opening up, I couldn't sleep, I was so anxious, I was so panicky. So even a small ordinary conversation can lead you to help that person in a very effective manner. Sometimes even actually you might be saving the lives of people when we socialize in a normal way, not that we try to impose our views and, our, whatever we understand, we are trying to impose upon other people. But when we socialize in a very loving, caring manner, people would be happy to approach us and tell them their problems. And like that, we can listen to them. So approach, listen. Listening here is something very rare nowadays. Not only nowadays, in every century, we are all quick to speak. But to listen, it requires a little more patience, little more stamina. Of course, we all have limited time, only 24 hours all of us have in a day. And we all are limited in time and many resources. But as much as possible to give a quality time. And of course, if we are not able to afford that much time, we can refer to some other person who can afford to, some other professional person, preferably, who can listen to that person better and help that person better. So approach, listen, and reassure that you care about their well-being and understand their problem is real. So sometimes actually we think that, sometimes people tend to say that, oh, all that is okay, it's okay, it's okay. So that might sound like trivializing their problem. Oh, they are not understanding the seriousness of the gravity of the situation that I'm undergoing, is what the other person would be thinking over there. So understanding the seriousness of the problem, acknowledging their distress. Even in psychiatry, we say that we allow the patient to ventilate and acknowledge their distress. So just acknowledge that I understand that you are distressed. Not that everything is okay when everything is not really okay, but we acknowledge that the problem is real, and we'll see how we can help to the maximum with medicines, with counseling, with follow-up. So like that, reassuring, and of course, actually, it is not a false reassurance also. It is really awesome and wonderful that we have got very effective psychiatric medicines in antidepressants category, in anxiolytic category, in antipsychotic category, and we can really help people. As a professional psychiatrist who see patients almost every day, I can say that, when we see the dramatic change that they come up with during their follow-ups, we know that the medicines are really effective. We know that the words that we speak are effective. We know that the therapy is effective. It is not just a false reassurance that somehow to pacify them. Of course, we need to pacify them, but it is a real reassurance that, of course, there are when there is sleep problem, when there is panic, when there is anxiety symptoms, when there is depression, when there is loss of hope, we can medical, even in medical perspective, there is much hope, and even the supportive psychotherapy and other psychotherapeutic means and all, there is much hope, and we can do a lot. Of course, we are not God, and we cannot change every situation altogether, but we can really help them to the very best, and most of them will come out very quickly itself. Some of them it might take a little more time. Some of them, for some of them, it might take a little more time, but be patient. And, sometimes we may have to increase the dose of the medicines, change the doses of medicines. Sometimes we need to have closer follow-up, regular monitoring, and sometimes even inpatient stay. But mostly, outpatients would be able to manage. So like that, so approaching in the right way, listening, reassuring, immediate. Decide if you need to take immediate action. If it is, so if suppose that other person at the person at the other end is on the verge of suicide or something, it is something that needs immediate attention. So immediate referral to a mental health professional, immediately informing the family members, the close relatives and friends, and what can be immediately done. Delaying, sometimes it can be disastrous. So, and guiding that person properly, guide them towards expert help. Trained mental health professional will be the best person to guide, and hope. One of the symptoms, one of the warning signs for a person to commit suicide is hopelessness, feelings of hopelessness. If somebody feels that there is no hope in living, they tend to end up their life. So instilling hope in them, even our sincere words, not some flattery, flowery words, but sincere words from the depths of our heart. Suppose if our own family member, if our own brother or sister or mother or father or grandmother or grandfather, our own child is the person who is sitting over there, and how we would feel that person. What we call empathy, ability to feel the other person's feeling. Of course, nobody can have the perfect empathy. Only God can have that. But we can have little more of that. If we put ourselves in the same shoes as the other person. If I was in that person's place, as we say, treat others in the same way, say like you would like others to treat you. Treat others in the same way as you would like others to treat you if you were in the same place. So if I was in that person's place, if my sister was in that place, if my mother was in that place, if my brother was in that place, then we'll be able to feel better for that person. What all trauma, what all abuse, what all uh, what all traumatic events that person has undergone in his or her life, then actually we'll be able to be a little more compassionate, and we'll be able to say words that are more effective, words that are powerful and encouraging and instilling hope. Even without being a professional mental health counselor, and all, we can, our sincere words, humane words, can instill much hope in people. Even a warm smile, and a quality time spent together, and reassurance, all can work wonders in people's life. And together. So, all right, the last letter is T, together. So you're not alone. I'm here with you. We are here with you. Our team is with you. Spending time together with the family and friends can be great for your general health as well as your mental health. So like that, there are, this acronym, all right, we can remember. Another, this slide speaks about generally about the hurdles or the difficulties. Why should I approach a psychiatrist or a psychologist? Many people are unaware that a psychiatrist can help them. Oh, how can I tell all these personal problems to one strange man or woman sitting over there who calls himself or herself as a psychiatrist? So, but actually, we are trained to handle even the most personal problems of people. Sometimes it could be some marital discord, some interpersonal relationship problems, and so many things like that. So even the awareness that a psychiatrist, although he's a medical, I mean, many people will be thinking, if I have a cough and cold and fever and all, I can go and tell the doctor. So how can I go and tell the doctor that my husband is suspecting me, my wife is torturing me by suspecting me, or she's saying things which are not real, or she is crying all the time. So how can I say that kind of problems? So many a time that a lack of awareness can be a hurdle, and many times the stigma, especially in our conservative society, which is changing much, hesitant and ambivalent about approaching a psychiatrist because of the stigma. There is a bad reputation if I go and see a psychiatrist. What will other people say? Will they say that I am mad or I am crazy? But actually, what we have to understand is that it is not, of course, even these mad, crazy, those kinds of terms shouldn't be actually be used even. But what we have to understand is that, actually, even we all normal people can undergo much stress when we face many problems in our practical day-to-day life, and anyone can have some sleep problems or some stress or some professional guidance, or anyone can be in need of some professional guidance at any point of their life. And for that, a psychiatrist can be approached. So there is nothing to stigmatize it. Even when we hear other people, of course, I see, some of these, even the young generation people, their friends would be motivating them. Sometimes actually the family, the parents and all would be very hesitant, but sometimes the friends would be encouraging them. It's all right to see a psychiatrist, nothing to feel stigma about that. But at the other end, there are many friends who might be, what to say, bad mouthing and spreading false stories and all. But we cannot help that. We cannot change everybody. But the stigma and all. If each one of us change our approach to mental health symptoms and people suffering with problems of mental health, the stigma can be avoided, and of course, it will lessen and lessen in the coming weeks and years and decades, as we hope. And worry about the side effects of medicines. The fact is that there are many newer medicines which lesser side effect. And even older medicines also, if it is used, and if the right medicine is used in the right dose for the right patient, it can work wonders. This from, when we see patients day to day, every day, and when we see them at follow up, and actually, almost there will be nil side effects for most of the medicines if it is used in the right dose. Sometimes even if there are some side effects or something, if you report it to the doctor can decide whether to change over to some other medicines or to decrease the dose a little bit or to add some other medicine to counter that side effect. So nothing to really worry about the side effects. And another hurdle is worry whether these medicines are all addictive. Actually, indeed, one category of the psychiatric medicines called benzodiazepines, in which comes the lorazepam, diazepam, clonazepam, and all. They are the medicines are addictive. So a good psychiatrist will use that medicine very rationally only. But all the other categories of medicines are all non-addictive. So it is a misnomer, it's a misconception that all the psychiatric medicines are addictive. It is nothing like that. And worry about the cost of the medicines also is a great hurdle for many people. But it shouldn't be actually be so. Psychiatric medicines are not that as costly. And also now, our government under the district mental health program, state mental health programs and all, even government is supplying many of these medicines free of cost to the needy ones. And are these mental health problems similar to other mental health problems? In one way, it is similar. If so, why there is so much stigma about it? In one way, it is similar. Just like if you have some cardiac problem, you would go to the cardiologist. If you have some kidney-related problem, you will go to a nephrologist. If you have some eye-related problem, you will go to an ophthalmologist. But actually, if you have a mind-related problems, you'd be very hesitant. Oh, should I go to a psychiatrist? How can I tell about that to other people if other people see me at a psychiatrist clinic? What will they think about me? So actually we have to understand it is similar, very much similar to, because actually our mind is actually the functions of our brain. Just like our eye is an organ, ear is an organ, heart is an organ, brain is a master organ. And the functions of the brain, we call it together the mental functions, cognitive functions, mind and all, we refer to that term as the functions of the brain. So just like other parts of our body can have problem, our brain functions also can have some problem. It can be just feelings of stress and feelings of anxiety and depression and feeling like crying all the time or feeling sad all the time. So it can all be some dysfunctioning in the normal brain functioning. So in one sense that is similar, but of course, unlike other non-psychiatric problems, many of the psychiatric problems will be precipitated by stress-related factors, familial factors, environmental factors, and just like some some financial loss or some failure in some exam, all these can precipitate all these symptoms and all. Of course, actually, even many physical symptoms can be precipitated by this mental stress. So in that way, it is different, but in many ways, it is similar also. So how should we change our attitude? When each one of us change our attitude, the whole attitude of the society will be changed, and we can of course actually even our day-to-day conversations and all, we can whatever we know about all these psychiatric problems and people taking psychiatric medicines and getting well and all, we can tell that to other people. And even nowadays, it's a good thing that many of our celebrities, even movie celebrities and all, come out saying that they had suffered from depressive symptoms and they have taken medicines and therapy, and now they are doing well. And that itself has decreased a lot of stigma among the general population. So, and I mean, I've seen that what we usually see in our day-to-day practice is that many people would be referred by other patients of mine. Some patient would be recovering, and when they come and see me, I'll ask them. Sometimes I ask them, how do you come to? How did you come to know about me? And they will say that, one of my relatives, he had come and he has become well now. He's even off medicines, and so that person, we know that person, so that's why we came. So like that, actually, even the good recovery of people itself would be a great testimony to many other people, that when they come across some problem, they will be able to guide. So like that, the awareness, good awareness also spreads. But actually, unfortunately, there are people who spread rumors and false stories. So they will be scaring people that you shouldn't take all these medicines. And how I respond to such people is that, you people will be telling like that till you or one of your family members or close ones will begin to have these symptoms. When you begin to have these symptoms, you will come immediately to the psychiatrist and take help. But you might have you might have scared many people from approaching a psychiatrist, and they would be going to sorcery and black magic and many superstitious ways, and they would have wasted a lot of money in that. And so many sad stories are also like that. So how do people commonly develop mental health problems? In simplistic manner, we can say stress. Of course, there are genetic factors are there, but genetic factors are there in varying proportion in everyone. In every family, there will be some close or distant relative who might be having some mental health issues and all, even some substance-related issues and all. But mainly, it would be the stress and how we cope up with the stress. Many of these problems in our life will become like a burden upon our mind. Just like if there is a burden upon our head, it exerts a pressure over our whole body. Like that, the problems in our life can exert a pressure upon our mind, upon our whole being, and that we can call as stress. Even in physics, we say stress is pressure by force by area. So, like that. So, that pressure that we feel when we face many problems. The problems can be just some failures in our own life. It can be academic failures for students, or it can be professional failure in a workplace that you are not able to do well. Recently, there was a ASHA worker, was one lady who is in the health field only, but she was not able to do as well as the other colleagues could do, and somebody said some bad remark, and after that she was very panicky and she was very anxious and she was not able to do. So even actually it won't be real failures, but it would be just an apparent failure. Or it can be problems due to other persons persons behaving or doing things in a way that you do not like. So from other persons, problems can be there. From other circumstances or events, that is the other thing. Some events or circumstances that are contrary to how you expected or wanted. So adverse circumstances, adverse persons, and even failures in our own life, all this can exert a pressure. And if we tend to brood over all these things, and the problems, the list can continue. Can be fights within the family, fights outside the family, financial problems, loss of business, loss of reputation, loss of property, failure, disease, death, work overload, and even it can be lack of employment. For many people, it is unemployment is a stress. Some people who are employed, they are overloaded with work at their workplace, too much work to do. So unemployment as well as work overload, all are stress. Anything can, if we even for some people, some things would be normal. For other people, the same thing can be very, very much stressful. Like how we view things, how we see the things, how we handle things, all depends on how we develop these stress-related symptoms. So some people come out of all these difficulties. We all would have faced some of these adverse circumstances in our life, and all this would have made us stronger persons also. As I usually tell people that, of course, even today or yesterday also, I was telling somebody, he was asking, I'm not able, today one online consultation, when some 35-year-old man, married man with wife and kids and all, and he was telling, why I'm suffering like this, I'm not able to understand. So I said that God has allowed all these problems in your life to make you a stronger person, not to make you bitter, but rather to make you better. So it depends on how you see things and how we perceive all these things. So faith and hobbies and support from your family, friends, etc., can help you to come out of all these difficulties. But what happens is, unfortunately, is that many people keep on thinking about the problem. They will be brooding over that and keeping on thinking, and then slowly there will be some neurochemical changes in their minds, in their brains, and that would manifest as changes in behavior, which manifests as mental health problems. And for a quick screening, after these, there would be a series of slides with many symptoms of mental health many symptoms of mental health problems I would be going through. So for a quick screening, what we can ask, like as I said, if you see your colleagues with some sleepiness in the workplace and all, or even actually you feel that that person is not looking that happy and fresh in the workplace as he or she used to look before, you can ask, how is your sleep, how's everything. We cannot ask that, do you have any psychiatric problem? It would be very crazy to ask like that. But you can ask, how's your sleep, how is everything, how is your family, like that. When we sincerely ask, from the expressions we can make out, and they might be, according to the freedom that they have with us, they might feel free to tell us how they feel, and they might say that there is some problem in the family, some financial problem, some disease of some loved one. So like that, they might be telling things. And for men especially, you can ask about the substance related. Is there any alcohol issue? Cigarettes, BDs, tobacco products, and cannabis, and all those things. And all. According to the age and background, and all, we can ask and see whether they are addicted to any of these substances, whether that is causing much of the problems in their life. So like that, for this quick screening, this simple questions and all will help us, and we can guide them to a proper good psychiatrist for more professional help. And what are the common symptoms of mental health problems? So this slide is depicting 3 symptoms, which are the 3 cardinal symptoms of depression, which every one of us should know about. One is pervasive low mood. Even the word depression means depression, means sad. So sad mood. So anybody can have a sad mood for a while because of some circumstances in the life. But if it is pervasive low mood, especially if it is more than 2 weeks and all, we need not wait for 2 weeks for us to go to a psychiatrist. But pervasive low mood all throughout the day, and lack of interest in everything, even previously pleasurable activities like some good hobbies, watching good programs, or hearing good music, or being together with the friends and family, all which had been pleasurable at one point of time. Now you are not finding any pleasure in all those things, and you don't find interest in anything. What we call anhedonia. That means lack of interest in anything. And excessive fatigue. You feel like tired all the time. You feel like lying down all the time. So these 3 cardinal symptoms of depression: pervasive low mood, lack of interest in anything, especially lack of interest in previously pleasurable activities, and excessive fatigue or easy fatigability. And difficulty in interacting with other people, difficulty in socializing, sleep problems. It can be decreased sleep many a time, or it can be increased sleep also. And this thoughts about suicide, threats about suicide, writing even in the WhatsApp status or the Facebook, or even attempted suicide. All these things are grave symptoms that has to be addressed deeper by a professional. And stress, the feelings of stress, that you are very pressured and stressed out, anxiety, palpitation, and increased heart rate, and you feel anxious about everything. Or increase or decrease in speech. Sometimes actually, even in depression, there can be increase in speech or decrease in speech. Usually there will be decrease in speech. They won't be verbalizing anything. They will be sitting in a quiet corner all the time. Sometimes it can be because of agitation. There can be increased speech. Or the opposite of depression is the mania, where there will be increased speech and increased energy levels and increased increased socialization, all familiarity and what would be there. And other features of depression can be decrease in attention and concentration. Can be not only in depression, even psychosis that can be there, even in some anxiety disorders also it can be there. So, but these symptoms can be there as part of many syndromes. We need to fix which syndrome that person is suffering from, whether it is just a depression, or just psychosis, or just depression with psychosis, or psychosis with some depressive symptoms. That of course the professional has to fix the diagnosis. But as a layman, every person should be able to know the list of all these symptoms. Decrease in attention and concentration, especially for students, they're not able to study well. For employees, that they are not able to work well. And or even for housewives, they're not able to do all the household chores in their house as well as they used to do before. And loss of appetite can be there. Sometimes it can be increased appetite. There can be eating disorders like bulimia, anorexia, and all. Sometimes the symptoms would be fear and suspicions. Sometimes it can be just irrational fear that somebody is against me, all are talking about me, suspicions that are suspecting the wife's or husband's fidelity. So all these things also will be coming in the coming slides. Re-experience the trauma in PTSD, post-traumatic stress disorder, after this excessive stress due to some even deluge, flood, wars, rape, any of this excessive stressful events in their life, or even witnessing a road traffic accident or a death of a loved one. Re-experiencing the trauma through intrusive, distressing recollection of the events, flashbacks, and nightmares. In children, repetitive play may occur in which these themes or aspects of the traumatic events are expressed. And avoidance of traumatic reminders. You do not want to drive through that road because, there you witness some accident or death, or you do not want to visit that home. So some avoidance of traumatic reminders. A persistent sense of current threat that is manifested by exaggerated startle and hypervigilance, emotional numbness, anger control problems. Anger control problems can be part of some psychiatric issues. It can be just some behavioral problem also, personality problem also. So all these are many symptoms, and we need to fix what the diagnosis would be. Of course, the professional psychiatrist should be able to do that. And unexplained physical symptoms. Sometimes it will be just the physical symptoms, and you will be going to the physician, you will be going to the neurologist, you will be going to the ENT surgeon, you will be going to the ophthalmologist, you will be going to all specialties except psychiatry. Finally, the doctor will be doing all the investigations and examination and say that everything is physically all right. What your experience is mainly stress-related symptoms. You please go and see the psychiatrist. And so it can be unexplained physical symptoms. It will be physical symptoms, but the cause would be psychological cause. And then this typical psychotic syndrome of auditory hallucination, hearing voices in the ear when all alone. You're sitting all alone, but you're hearing voices in your ear clearly. And then you would be responding to that, and which will appear to other people as talking and muttering and smiling all alone. Violent behavior, suspecting spouse's fidelity falsely, neglecting one's personal hygiene, not going for work for no reason, and feeling of being controlled by an external agency, other strange experiences and behaviors. So if I begin to say stories, it would go on and on. So just going through. Then this recurrent irrational thoughts, that is OCD, obsessive compulsive disorder, where typically the typical OCD would be the washing and cleaning OCD, where there would be, and of course there are many other OCD also. It can be obsessions of blasphemy, obsession of aggression. Obsession of aggression meaning whether I would act violently to my spouse or my child. The person won't act like that, but he gets those thoughts and he would be very much distressed. So recurrent irrational thoughts and acts like repeated washing and checking. Can be checking again and again whether the gas stove is off or not, whether the latch of the door is put or not. Like that, recurrent irrational. It is irrational, but again and again it is coming. So that is obsession, and the repeated acts are called compulsion. So when it becomes in a disorderly level, we call it obsessive compulsive disorder. Then there can be memory problems. It can be just the memory problems of students. So it can be old age related memory problems. So it can be stress-related memory problems. It can be even caused due to vitamin B12 deficiency, some things like that. So we need to rule out, what is causing the memory problems. And problems in food intake. It can be decreased food intake or increased food intake, and gaining weight and all. And sexual problems, sexual misconceptions, and all would be there. Addiction to alcohol, nicotine, drugs, social media, video games, internet pornography, etc. All these addictions are becoming more and more common. But nowadays, this even phone addiction, social media addiction, Facebook addiction, WhatsApp addiction. Of course, all these things are WhatsApp, Facebook, all these social media useful when it is used in the right way. But when you do not have time for even other responsible activities in your life, but you are spending all the time with the phone, then that has to be dealt with. personality disorders. There can be different kinds of character patterns in people, interpersonal conflicts. It can be in the family or in the workplace or in the neighborhood, family problems, marriage related problems, career and job related problems, learning problems, behavioral emotional problems in children and teenagers. So all these are symptoms of mental health problems. It can be just guilt of some past event that has occurred. Even can be some spiritual conflicts. So why am I here? Why should I live? Existential problems and all. So addressing the stigma. So we saw the list of many of the major symptoms of mental health problems. And one thing we need to know is that one way to address the stigma is that there are different categories of problem. It is not that only the violent, aggressive people with no self-control and that kind of violent person, they are the only people who need some psychiatric help. But it is even a person with a little stress in his life, some sleep problems, some anxiety that is incapacitating him, when that person needs some help. So it can be all these psychiatric problems are not in the same category. There are different categories. Sometimes the manic or extremely psychotic patients would be behaving very violently and weirdly and all. And so people will be thinking that if I go to a psychiatrist, I will also be categorized in the same category. No, not like that. There are different categories. Even students with some study problems will come. Even with children with some attention deficit and hyperactivity, they are fidgety all the time. Those children also would be brought sometimes. So it can be just some interpersonal problems. So different categories are there, and instilling awareness about the different categories itself will destigmatize a lot of people. And one another thing is that all these things are very common. When you saw all the symptoms list, you yourself would have find yourself in some of these categories. And sometimes, that relative, that friend of mine is having this problem, that problem, this problem. So it is very common, actually. Anyone can develop at any point of time. Nobody is immune. So we are all human beings. We are in this sin-cursed earth. So any person can develop any of these symptoms at any point of time. And it is not always medicine. Sometimes it will be just the counseling. So mild, moderate, severe, if you categorize like that. Mild, probably only the medicines. Mild, probably only the counseling is needed. Moderate, you might need some counseling as well as some small doses of medicine. In severe category, it would be mainly medicines that you would need, but counseling also can help as a supportive method. But mainly medicines has to be given. So like that, it is not always medicines, counseling also, but it is not always counseling, medicines also at the right time. And one other thing is that stress can predispose, precipitate, exaggerate these physical symptoms. So hence, it is better to deal with stress early and address the stigma, clarify misconception. It is not lifelong medicines or anything. After you get good symptom remission, you might be advised to continue the medicines for a few months where you are totally symptom free and stable, and then slowly the doctor would be decreasing the doses of medicines and all. And as I already said, all these medicines are not addictive. Of course, there are addictive medicines in the benzodiazepine category, especially that a good doctor would be using it very rationally, only if it is inevitable only. And side effects also, if we go to the minimum effective dose handles, even when we combine counseling also, smaller doses all itself, there would be good symptom relief. And, there would be medicine suitable for that each person according to the age and gender and the other body parameters, and the medicine suitable for that person can be decided by a doctor, and monitoring for the side effects, adjusting the dose, changing the medicines, adding a medicine to counter side effects. All those things are there. So, nothing to worry about the side effects. And each of us has to change our attitudes. And how to approach these symptoms, prompt treatment. Earlier, the better. Not something to be covered up. These neurochemical changes can worsen with time. Suicide may be unpredictable. And take counseling and medicines as needed. Is mental health so important? Now you would have got the answer. Sound mind in a sound body. So mind-body relationship is say problems in your mind like fear and anxiety can affect your body by making you physically weak and prone to various bodily illnesses. And in turn, physical ailments also can affect your mental health also. And no to suicide. Suicide can be sometimes a cry for help. Suicide is a thief. It steals joy. Not only it steals joy, future, dreams, love, hope, and everything. Suicide will be stealing. And of course, this helpline numbers and all are there. And why not to suicide? I usually say this, at least these four things. Sometimes actually people think that, oh, I'm in a dead end. There is no other go. When it initially the first wave of COVID hit us and all, hit the whole world and all, we thought that, oh, everything is going to end. But we know that situations changed. It will change. Everything will change. Only things that only that which doesn't change is change. Situations will change for the better. And if the suicide attempt is unsuccessful, there will be medical complications, legal complications. There will be financial complications and occupational complications, the guilt and the shame because of that. And if the suicide is successful and a person dies, then imagine the sorrow of the family and the other loved ones, how much sorrow that you would be causing to other people. And finally, we need to give an account to God. So, no to suicide. Suicide is never an option. Of course, there is good help that is awaiting you. And about stress management and all, I am not taking much time. I'm just concluding 5 steps of stress management. I'll just go through the slides quickly. Spiritual, psychological, even my if any of you wants further to hear regarding all this and all, many are there in my YouTube channel. If you search in the YouTube, Dr. Sandeep, Psychiatrist, Karunagappally, or Dr. Sandeep, Psychiatrist, Kerala, you will get my YouTube channel. Dr. Sandeep, Psychiatrist, Karunagappally is my YouTube channel name. And in it, of course, many of the content of my YouTube channel is actually Bible related and all, but one playlist is there, which is this professional, this thing, where mental health counseling, stress, anxiety, all these things are there. So that anybody who needs further clarification and help and guidance can approach. My number is there in the Google itself, as well as in my YouTube video description box itself. My phone number for appointment and all are given. So 5 steps of stress management: spiritual, psychological, physical, exercise, diet, pharmacological. This is one slide, a picture that one of my clients designed for me when I was in Vellore in Karigiri. At my request, he how we can cast all our burdens unto God and how we can rest like a little child is a message. And spiritual ways to manage stress, and acronym C is they: cast your burdens, count your blessings, consider from a higher long-term perspective. You are being crushed today to comfort many others tomorrow. It is to conform to his likeness that we are going through these trials to bring us closer in fellowship with the Almighty. And psychological ways to manage stress, as we all say, music and reading good books, gardening, embroidery, drawing, painting, picnic. Many of these hobbies and all can give us much stress. Taking a break, acknowledging our limitations. Now, don't think that you alone should do everything, but when you can get help from others, get help from others also. Delegate tasks to other people also, getting help from others, having good guides and friends and mentor, and keeping our minds engaged productively. Idle mind is a devil's workshop. And ventilate, and even you can write diary, sleep for 8 hours. That can help in cytokine regulations, which will help you in the inflammatory responses in our body, and as well as it will improve our immunity. Good sleep for at least 7 to 8 hours. And when we forgive people, there will be less of cortisol, less of stress hormones. If you are bitter and embittered and hostile to people, there will be more of stress in your system, and your immunity itself will go down, and you will become easily sick. And appreciating, helping others, charity and all can improve your serotonin levels in your system. Time schedule and achieving short targets can improve the dopamine levels in your system. Dopamine and serotonin, they are even oxytocin, all are happy hormones. Dopamine is called the pleasure neurotransmitter and all. And good family relationships, good friends, and all can improve the oxytocin level. Oxytocin is called the cuddle hormone or love hormone. And physical exercise, engaging in physical exercise, cycling, swimming, aerobic and aerobic and all those, at least some 45 minutes to 1 hour in a day, all can improve the endorphin levels in our brain. Endorphins are happy hormones again. And with exercise, especially if you do in bright sunlight, and you will get some vitamin D also through the sunlight also. Endorphins also will be improving. And good diet, avoiding junk foods and more of fresh fruits and vegetables, moderate non-vegetarian, and minimizing the fried items and fatty, that kind of bakery items and all that. Medicines are prescribed by a professional psychiatrist. And then this emotional first aid, recognize when you are in emotional pain, be gentle and compassionate with yourself, distract yourself with rumination, redefine your view of failure, find meaning in loss, all those things. And all these we can overcome together. There is nothing too hard to handle or anything. So we all can overcome together. And there is a ray of hope in every, even the darkest of situations in our life. There is a ray of hope. All these are my details, which are there in the Google itself, YouTube, my videos, description box also. All these details are there. Even through library, you can call me and fix appointment between 9 a.m. to 2 p.m. on non-Sunday days. So my number is also given over there. So thank you everyone. Hope you understood everything, and hope you were able to follow, and hope you will be able to help many others with the information that you gathered today. God bless you all. Thank you. Thank you, Team Library, for this opportunity. Thank you.
Thank you so much, Doctor, for the insightful session. Thanks for your time, Doctor.
Thank you.